Most people misunderstand rheumatoid arthritis, and that misunderstanding can cost them time, mobility, and long-term health. In this video, I'll break down the #1 mistake people make about rheumatoid arthritis and show you exactly what to do instead. If you or someone you know has rheumatoid arthritis, then you already know it's an autoimmune disease that affects the entire body, joints, energy, even internal organs in some cases. But one major misconception keeps people from managing it the right way. And when that mistake is repeated over weeks, months, or even years, it leads to more pain, more joint damage, and worse quality of life. Let's break it down clearly. First, thinking rheumatoid arthritis is just joint pain. This is the most common and most damaging mistake. A lot of people treat rheumatoid arthritis like it's just another form of arthritis. They compare it to osteoarthritis, where cartilage wears down over time. They assume rheumatoid arthritis is caused by aging, overuse, or injury. But that's not how rheumatoid arthritis works. Rheumatoid arthritis is an autoimmune disease. It happens when your immune system mistakenly attacks the lining of your joints, called the synovium. This causes inflammation inside the joint, not just on the surface. Over time, that inflammation destroys cartilage, erodes bone, and deforms joints. And the damage doesn't stop there. Rheumatoid arthritis is systemic. That means it can affect blood vessels, lungs, eyes, and the heart. It also impacts your energy, sleep, and mental clarity. So the mistake is in the definition and how people respond to rheumatoid arthritis. If you think it's just joint pain, you're more likely to wait too long, ignore symptoms, or use the wrong treatment approach. But why does this mistake happen? There are 3 reasons this misunderstanding is so common. 1. The word arthritis is misleading. The word itself makes people think of creaky joints and old age. But rheumatoid arthritis has very little in common with the typical wear and tear model. The name downplays the severity of the condition. 2. Early symptoms can be subtle: morning stiffness, low energy, mild swelling. These are easy to dismiss or blame on stress, poor sleep, or aging. People often try to push through instead of looking deeper. 3. Some treatments mask symptoms. Over-the-counter pain relievers can hide inflammation temporarily, so a person may feel better for a few hours, but the disease process continues slowly in the background. This leads to delays in diagnosis, delays in starting the right treatment, and more damage before action is taken. What are the consequences of waiting too long? Delaying proper treatment is one of the most dangerous outcomes of this mistake. Rheumatoid arthritis progresses quickly, especially in the first 2 years. This is when most joint damage happens. If you're not treating the immune system early on, damage accumulates fast. Once cartilage is gone or joints are deformed, that damage can't be reversed. Medications can slow the disease or stop its progression, but they can't undo the damage that's already done. Early treatment gives you the best chance at preserving joint function and reducing complications. So, what should you do instead? Start by treating rheumatoid arthritis as an immune system problem and not just a pain problem. 1. Don't wait for the pain to get bad enough. If you're experiencing joint stiffness that lasts more than 30 minutes in the morning, persistent fatigue, or swelling in multiple joints, especially small joints in the hands or feet, get evaluated. Ask your doctor specifically about rheumatoid arthritis. Request lab tests like rheumatoid factor, anti-CCP, and ESR or CRP to check for inflammation. Don't settle for a vague diagnosis like arthritis or inflammation. 2. Understand that long-term control requires medical treatment. Lifestyle changes can help reduce inflammation and improve how you feel, but they don't replace medical therapy. Rheumatoid arthritis is not a condition you can treat with just diet or supplements. Current medical guidelines recommend disease-modifying antirheumatic drugs, otherwise known as DMADs, to control immune activity. These medications don't just manage pain, they actually target the root of the disease. The goal is low disease activity. That means stopping damage before it happens. 3. Monitor your body beyond your joints. Rheumatoid arthritis can affect your lungs, eyes, skin, and even increase the risk of heart disease. So if you're feeling breathless, dealing with dry eyes, chest pain, or skin nodules, mention it to your doctor. These are all connected to rheumatoid arthritis and need to be addressed as part of your treatment plan. 4. Be consistent with follow-up even when you feel okay. Some people start treatment, feel better, and assume the disease is gone. Then they stop meds or skip checkups. The problem is, rheumatoid arthritis doesn't disappear. The inflammation may just stay low for a while, and when untreated, it comes back stronger. Regular monitoring allows your doctor to adjust treatment before damage returns. Staying ahead of the disease is how you protect your joints and quality of life long term. Now, what about natural remedies? This is a question that comes up a lot. There's nothing wrong with trying things like anti-inflammatory foods, turmeric, omega-3s, or gentle movement. These can support your overall health and may reduce mild symptoms. But they are not substitutes for medical therapy. Rheumatoid arthritis is not a condition to manage casually. If you rely only on natural remedies while joint damage continues silently, the consequences are permanent. So yes, support your body, but do it alongside real treatment, not instead of it. In a moment, I'll recap the key takeaways so you can walk away knowing exactly what to watch out for, and what to do next if rheumatoid arthritis is something you or someone close to you is facing. If this video helped clear up something you've been unsure about, go ahead and tap the like button. It helps more people get the right information, and it lets me know this kind of content is valued. Here's a quick summary of what we covered. 1. The biggest mistake people make about rheumatoid arthritis is thinking it's just joint pain. 2. Rheumatoid arthritis is an autoimmune condition that affects the whole body and not just joints. 3. Delaying treatment can lead to permanent damage in a short amount of time. 4. The right way to manage rheumatoid arthritis is with early medical treatment, close monitoring, and supportive lifestyle changes, not guesswork. And 5. Diet, exercise, and supplements are useful, but only when paired with proper medication. If you're dealing with rheumatoid arthritis symptoms, don't wait. Talk to a rheumatologist. Get the labs done. Start treatment early and stay consistent. We post new videos every day, including tips for managing chronic illness, staying active, and protecting your health long-term. If you haven't already, hit subscribe and turn on the notification bell so you don't miss the next one. If you missed our video on how to manage rheumatoid arthritis flares and fatigue, it's linked right here on screen. Thanks for watching, and see you in my next one.